The subendocardial zone is the first part of the myocardium showing irreversible injury. And this is because the subendocardial zone of the myocardium is the last area to receive blood delivered by the epicardial vessels, which are present at the outer surface of the heart in one hand. On the other hand, it's exposed to the relatively high intramural pressure, which acts to decrease the blood flow to this layer. If the ischemic event continues, then more cells will die through the other regions of the myocardium, and the infarct reaches its full extent within 3 to 6 hours. In the absence of intervention, the infarct can involve the entire wall thickness, and this is what we call transmural infarction. This figure shows different macroscopic changes related to myocardial infarction. Please note that the posterior cardiac wall is at the top. The black arrow points to an area involved by acute myocardial infarction of the posterior lateral left ventricle. The arrowhead points to an old anterior scar, indicating a remote infarction. The star marks an area of myocardial hemorrhage due to ventricular rupture, and this was the acute cause of death in this patient. Let's start discussing the gross or macroscopic features of myocardial infarctions. Myocardial infarction of less than 12 hours old usually do not show gross changes. By 12 to 24 hours after infarction, red-blue discoloration appears. Then the infarct becomes softer, yellow-tan in color. By the 10th to the 14th days, infarcts are rimmed by a hyperemic granulation tissue. Weeks after, the infarcted tissue evolves into fibrous scar. Microscopically, the typical features of coagulative necrosis become detectable within 4 to 12 hours after the myocardial infarction. Necrotic myocardium induces an acute inflammatory reaction within 1 to 3 days. This is followed by the aggregation of macrophages. Macrophages come to the tissue to remove the necrotic myocytes and the neutrophil fragments, becoming more prominent within 5 to 10 days after myocardial infarction. Infarcted zone is progressively replaced by granulation tissue most prominent within 1 to 2 weeks after myocardial infarction. This figure shows the microscopic features of myocardial infarction. The first figure to the left is for a 1-day-old infarct, showing coagulative necrosis and wavy fibers if you compare that to the adjacent normal fibers to the right. The middle figure shows dense neutrophilic infiltrate in a 2 to 3-day-old infarct. The right figure shows almost complete removal of necrotic myocytes by phagocytic macrophages for a 7 to 10 days infarct. This figure shows also the microscopic features of myocardial infarction and its repair. Figure A is for a 1-day-old infarct showing coagulative necrosis and wavy fibers if compared to the adjacent normal fibers to the right. Figure B shows the dense neutrophilic infiltrate in a 2 to 3-day-old infarct. Figure C shows the almost complete removal of necrotic myocytes by phagocytic macrophages for a 7 to 10 days infarct. Figure D shows granulation tissue formation. Figure E shows a healed myocardial infarct consisting of dense collagenous scar.